everybody, I am Vivek, Gaur, your physical therapist, and today we are starting with a clinical case presentation that you and me will together differentially diagnose. So let's get started. This is an old case of mine which was presented to the neurological ward when I was posted over there. So a 21-year-old male patient is admitted to emergency with history of one-sided weakness that developed overnight, and he also had difficulty speaking. On examination, the patient had flaccid limbs on the right side and he could not speak but understood the commands. No visual field abnormalities, incontinence, seizures, headache were reported by the patient or by the family. The patient had no history of such symptoms in past, no medico-surgical history of any relevance, and no known drug allergies. Family history was positive for hyperlipidemia and hypertension, as well as diabetes from paternal side, and hyperlipidemia and hypertension from the maternal side. Now, this patient was a recent casual smoker, a habit that he developed in college, and it was only less than 1 year old casual habit. There was no history of alcohol intake or drug abuse that was reported. Now, once the patient is stabilized in emergency, they are shifted to wards, surgeries, or ICUs, depending on the kind of care they will be needing. This particular case was shifted to general neurological ward, where a consulting neurologist will take over the case. Now, what you have to do is make a list of differential diagnosis of this case. This is a case of acute onset unilateral paralysis and almost hemiplegic presentation with speech trouble. So think about all the causes that you can think of which can cause acute unilateral weakness in young adults and list them. Remember, you not only have to list all these causes, but you have to justify your list by enumerating the clinical presentation in such conditions. You also have to quote the relevant and latest researches and data if you have them. So once this is done, you have enumerated all the possible causes of diagnosis, then it becomes much more easier for you to write down the investigations. Those will be required to make the probable diagnosis in this case. And once that is done, then we can discuss the overview of management of such patients inside the hospital. We can definitely discuss the prognosis of such cases as well as the detailed rehabilitation. I'll be making more videos on detailed rehabilitation which will be coming up later, but then first we have to do the differential diagnosis. Alright guys, who is up for this challenge? Make a list of differential diagnosis. The whole video where I'll be discussing the entire differential diagnosis and all would be available on the student membership on my YouTube page. So do check over there. Meanwhile, you stay sharp. Bye-bye.